Hey everyone, we hope all you guys are staying safe and sane and studying hard. So today me and Selena
Hi.
are here for you guys and we're going to teach you the topic of neck triangles. Should be a fun topic, so let's get right into it. Well, anatomically the neck is a really complex region to study because it contains a lot of structures. So studying it in this way, i.e. the triangular way, makes life much simpler. So the neck triangles are the anterior triangle and the posterior triangle, which are separated by the sternocleidomastoid, which is the big muscle you can see in the picture right here. So let's start the anterior region, medially bordered by the midline of the neck, superiorly by the mandible, and laterally by the sternocleidomastoid muscle. Now, this triangle is split up into four other triangles, namely the submandibular triangle, the submental triangle, the carotid triangle, and the muscular triangle. So first up, we have the submandibular triangle, superiorly bordered by the mandible, laterally bordered by the posterior belly of the digastric muscle, and medially bordered by the anterior belly of the digastric muscle. Now, now for the contents, we'll find the submandibular gland and the facial vein quite superficial within this triangle. But as we go deeper, that's what he said, we'll find the submandibular ganglia, which is one of the parasympathetic ganglia of your head and neck region. We'll also find the facial artery and some submandibular lymph nodes, which drain the lymph from the tongue region. Now, within the submandibular triangle, we'll find two other topographical regions, namely the Pyrgos triangle and the Becklar's angle. So the Becklar's angle is an angle formed by the posterior belly of the digastric muscle and the greater horn of the hyoid bone. We can see in the picture, well, I've not drawn it accurately enough, but we can see that the hypoglossal nerve passes through this region into the submandibular triangle or the Pyrgos triangle specifically. Now, for the Pyrgos triangle, we see that it's bordered by the hypoglossal nerve arch and by the intermediate tendon of the digastric muscle. We can find the lingual vessels coursing through this region. Next up, we have the submandibular triangle. Now, a lot of resources will say that this is an unpaired triangle where the borders are formed by the hyoid bone inferiorly and the anterior belly of the digastric muscle on both the sides laterally. And some resources, I'm sorry about that, some resources will also say that medial borders the midline of the neck and this triangle is paired. So we'll go with the paired version because all the other triangles are paired and we don't want this one to feel lonely as such. So about the contents, there are submental lymph nodes which we can find in within this triangle, which drain lymph from the floor of your mouth, and we also have the submental artery, which is the branch of the facial artery, and the submental vein, which drains into the facial vein. Rule of thumb, guys, always remember that veins never branch, they drain. All right. Next up, we have the carotid triangle, superiorly bordered by the posterior belly of the digastric muscle, inferiorly bordered by the superior belly of the omohyoid muscle, and laterally bordered by the sternocleidomastoid muscle. The contents of this within this triangle can be classified as the ones which are contained within the carotid sheath and the ones which are outside the carotid sheath. Now, within the carotid sheath, we'll find the common carotid artery, which bifurcates into internal and external carotid artery, which are not the part of the carotid sheath. Then we have the internal jugular vein and the vagus nerve, also known as cranial nerve number 10. Now, outside the carotid sheath, as I said before, we'll find the external carotid artery because that's not the part of the sheath, and also a few of its branches like the superior thyroidal, the lingual, and the facial artery. We'll also see the superior root of the deep ansa cervicalis, which is a part of your cervical plexus. We also have the facial vein and the retromandibular vein draining into the internal jugular vein, even the lingual vein. We have the accessory nerve, which innervates your sternocleidomastoid muscle, and some lymph nodes. Next up, we have the muscular triangle. Now, this triangle is called muscular because it contains muscles, I guess, and bordered superiorly by the hyoid bone, medially by the midline of the neck, superior laterally by the omohyoid muscle, the superior belly to be specific, and inferior laterally by the sternocleidomastoid muscle. Now, about the contents. So, as I said before, it's called the muscular triangle. Why?
Because it has muscles.
Great job, Selena. It has the infrahyoid muscles, the larynx, which continues as the trachea, the thyroid and the parathyroid glands, which are a part of your endocrine system, and the anterior jugular vein. Well, that's all from me, and Selena, the stage is all yours.
Thanks. So I'm going to be talking about the lateral region of the neck and also a few of the triangles that will be very useful for you guys to know in the final exam. So, like I said, I will be discussing the lateral region, and it's bordered by the sternocleidomastoid, the clavicle, and the trapezius. The triangle itself is split into two triangles by the inferior belly of the omohyoid muscle. So therefore, we end up with the supraclavicular triangle, which is literally the triangle above the clavicle, so supraclavicular, and we have the occipital triangle. So we'll start with the top one. So we'll start with the occipital triangle. So the occipital triangle is the triangle in green on the diagram. So cranially, we can see that sternocleidomastoid borders is the border for this area. Dorsally, you have the trapezius muscle, and inferiorly, you have the inferior belly of the omohyoid muscle. Its contents consist of the phrenic nerve, the accessory nerve, puncta nervosum, which is clinically known as Erb's point. It's basically the point on the neck where all four sensory nerves and branches of the cervical plexus will converge at this point, and they just meet. We also have the external jugular vein, the transverse cervical artery, and the cervical lymph nodes. Right, next we have the supraclavicular triangle. So this is the triangle in pink on the diagram. So cranially, we can see that we have the omohyoid muscle, inferior belly. Caudally, it is bound by the clavicle, and ventrally, we can see it's the sternocleidomastoid again, which actually attaches onto the clavicle at this point, partially anyway. It contains the subclavian artery and vein. We can also find the supraclavicular part of the brachial plexus, the phrenic nerve, the transverse cervical artery, the external jugular vein, and the supraclavicular lymph nodes. Now, there are 2 points to note here. In terms of the lymph nodes, sometimes when you have a congregation of lymph nodes in a certain area, there will be certain lymph nodes that are located closer to lymph vessels, and these lymph nodes are called sentinel lymph nodes. So if any of them are inflamed, it usually is a sign of cancer, or it can be a sign of cancer. So in this case, in the supraclavicular area, Virchow's lymph nodes, which is one of the sentinel lymph nodes, if it's swollen or if you can palpate it on top of the clavicle or in an area superior to the clavicle, then it's a sign of stomach cancer. Lastly, the phrenic nerve, the transverse cervical artery, and the external jugular vein are the only 3 structures that are present in both triangles. So they run through both triangles from like superiorly to inferiorly, basically. Right, lastly, we have the other triangles. So with the suboccipital triangle, this is a triangle that's located on the posterior region of the skull. So the superior medial border is the rectus capitis posterior major, the inferior border is the obliquus capitis inferior, and the lateral border is the obliquus capitis superior muscle. Its contents consist of the vertebral artery and occipital nerve. With respect to the occipital artery itself, it passes superiorly to the triangle, but it's not actually inside the triangle, so we can't say it's one of the contents. We also have the scalenix fissure, which is the gap between the anterior and middle scalene muscles. So the anterior border is obviously the anterior scalene muscle, but the posterior border is the middle scalene muscle, and then it is caudally bound by the clavicle, effectively making it a triangle. And we can find the subclavian artery and the supraclavicular part of the brachial plexus passing through here. So that's all for neck triangles. We hope that you got to the end of this PowerPoint and enjoyed it as much as we enjoyed making it, and stay safe.
And healthy.
Bye. Good luck for exams.